So here we go. All right. Actually, I might want to go right here.
There you go.
Great. Thank you so much.
All right. No problem, guys.
Thank you very much. Thanks so much.
Everything you guys doing for us?
Thank you.
Support. See you again.
Thank you. Thank you.
Thank you so much. Operation Warp Speed is a success. This is St. Croix, US Virgin Islands, December 16th, and we received our vaccine, starting our vaccination program today with me. So we're going to dilute, and I'll take you a little bit through the steps, and we'll discuss why it's so important that we take this step serious and all of us take this vaccine. I'll go into the inside. These are our vials. So this is our freezer. We have minus 81 Celsius in here right now. It's being monitored on the outside, and also we're monitoring it remotely. We get messages to our cell phones, and different people get the message if this is out of range. It has to be at a minimum of minus 70, so we're keeping it at minus 81. It's locked, so not everybody has access to it, only the administrating nurse. And this is basically the freezer. So here you have a minus 81 degrees Celsius freezer where the vaccines will be stored when they arrive directly starting next week, Monday, from Pfizer, and we'll keep them straight with a transfer time from the box of 3 minutes, no more, right into the freezer. It shouldn't take that long either. And then we'll keep them here. Once they're frozen, they're good for 6 months. Once we take them out, we thaw them for 30 minutes. And after 30 minutes, we dilute it immediately. And after dilution, we can use them within 6 hours. So we set a time of 6 hours, and we have to use it within that 6 hour time period. So it's very important that we're planning who we're gonna give it to. That we have batches of 5 people coming, because every vial has 5 doses in there, so that we can administer 1 vial to 5 at a given time. So we're planning the thawing process according to who's getting the shot that day. So once it's diluted, we have 6 hours to inject. So we're in the process now of mixing it up and then injecting it. So we'll shake it 10 times gently, and then we can draw it up and inject.
We are injecting the good doctor.
So here we are. It's December 16th, 2020. It's St. Croix, US Virgin Islands. We're starting our vaccination program. The Operation Warp Speed has been a success. We received our vaccine. I think at this point we have to understand that the entire health force of the entire world is exhausted. I think there is not a healthcare worker or a public health servant that has not reached their limits at this point with the pandemic. And I think in order for us to be able to get to the other side of this pandemic, we have to take this important step. We have to make sure that everybody's safe. Until everybody is safe, we have to continue with our same safety measures, the same precautions. Even if you got vaccinated, keep your mask on, continue until we're all safe. I think at this point, we have to take this important step to have a healthier 2021 and to get beyond this pandemic. So for that reason, with all the concerns and reservations everybody has, inform yourself, read about it. You will see the short and long-term side effects that have been described of the vaccine. And yet here we are, despite all the social media publications where I, as a healthcare provider, ask you all to take this vaccine. I've read about it, I've informed myself about it. I think compared to other vaccines, this is a safe vaccine to take. And so with that, I'm ready to go ahead.
2, 3.
Good?
Yep.
Okay, thank you. Didn't even hurt. Not bad. Not bad. Do I get a lollipop?
A sticker with Scooby-Doo.
Alrighty. I got my sticker. So please do the same. Take the vaccine. Let's go on the other side of this pandemic. Let's make sure we're all doing the right thing. And you can follow me every day on social media. I let you know how I feel. I give you every day some updates, I address some questions and concerns you all had regarding who should take the vaccine, who shouldn't take the vaccine, and other questions that I received in order to give you some feedback every day. So with that, I think we're good.
All right, guys. I'm Lisa Gay. I'm a nurse practitioner with Plessen Healthcare, and I'm here getting the first dose of my COVID-19 vaccine. I couldn't be more excited despite getting took today. I've had the pleasure of being here in the Virgin Islands for 10 years, and my experience with this community is we come together when we need to come together, and this is one of those times. We need to come together. We need to get vaccinated. We have to achieve herd immunity. Here we go.
1, 2, 3.
Oh, that's not too bad. All right, you guys can do that. We can do this. It's time to reach our herd immunity, get our community back to working order, get our businesses back up and running, keep our elderly safe, all of us safe. So come get your vaccine. We're gonna follow all of the rules and guidelines with who gets it first. So keep up with that and come get it when you can. Thanks.
Good afternoon. I'm Jan Powell. I'm a nurse practitioner at Plessen Healthcare. And let me start by saying this first. I don't like shots, so this tells you how important I think this is. This is important for us to get on the other side of this pandemic, for us to get our life back. I'm doing this as a civil and as a responsibility to our community, to my family, to our country, and to all of us to get our life back. And it really wasn't that bad.
Hi, my name is Robin Stern. I'm an NA at Plessen Urgent Care, and I know that getting this vaccine is extremely important for our community and for everyone around us. And I'm very, very proud and honored to be a part of the first group.
Yay, Robin!
So it has been about 30 minutes now that I've been administered the COVID-19 vaccine. I feel fine. I don't notice anything. I don't have any reaction. I don't have any pain. My arm feels fine. The side feels okay. So it's even less painful than a flu shot that I have had in the past. And it's very important that all of us take this vaccine to keep our families safe. Don't be afraid. This is the only way that we get beyond the pandemic and help our community and keep us all safe. So please take this vaccine to keep our elderly safe, our healthcare workers, our community. And with that, here at Plessen Healthcare, we have started our vaccination program. It's December 16th, 2020, St. Croix, US Virgin Islands.